Would you say that is really enough at this time?
Yeah, thank you. It's an honor to join you on the news this afternoon. First, I think it's a positive, it's a welcome development that the First Lady has donated this amount. But I would say, is it particularly for a state, or is it for a particular local government? Because the fight against tuberculosis cuts across different local governments across the 36 states and the Federal Capital Territory in Nigeria. And the cost for treatment, the cost for diagnosis is extremely high. So I would say it's a welcome development, but we still have a long way to go, especially in the context of the recent developments from the USAID having halted the funding for tuberculosis. So I would just say it's an awareness that more needs to be done, and a welcome development as well.
And we've seen promising areas of research for developing new TB diagnostics treatment. But how do we actually bridge this gap between research figures and actually practicing some of these interventions to reduce the mortality rate?
Yeah, it's that's an important question. I think it's a huge gap, but we can start somewhere. And I believe that we've been making some progress so far in terms of understanding the mechanism of the infectious disease, Mycobacterium tuberculosis, and in terms of understanding how the bacteria becomes resistant to the commonly used, one of the commonly used antibiotics for treatment, rifampicin. So we are understanding that based on how we interact, how physicians interact with patients, how they treat and diagnose. So that is really good. But in terms of the research, I'm not sure much is being talked about in that aspect, especially for pulmonary tuberculosis. So a first step, which is ongoing, in understanding and then treating. And I think with that ongoing efforts, we would be encouraged eventually to invest more into research in terms of understanding and the effective treatment of the disease. The treatment takes 6 months. That is the drug susceptible tuberculosis. However, if there are more interventions or policies to find a more effective way for treating, why not? So yeah, and even in children as well, that is also another important aspect. Of course, you have children taking up the BCG vaccine to prevent them in case they're exposed to a tuberculosis patient. But once they become infected with tuberculosis, that treatment is also quite different. And we won't be able to understand this in details until we're able to invest more in research in our institutions across the country.
Utilizing information properly. For the purpose of public enlightenment, talk to us about the symptoms of tuberculosis and, of course, the risk factors that we have now.
Yes, the common symptoms of tuberculosis, patients come up with cough, could be dry cough. They also sweat at night. They feel feverish. There is also loss of weight. So these are the basic symptoms for tuberculosis. And of course, being exposed to a tuberculosis patient also increases the risk. In fact, from sputum or droplets that people get exposed to from people infected with tuberculosis and who are not on active treatment, it increases the risk. Another important risk factor is the immune status. People living with HIV are also at an increased risk of tuberculosis. And of course, with this, you want to examine or look or focus more on the impacts or how we have been able to manage HIV infection in Nigeria. And of course, if the treatment, the screening, which used to be free, are no longer free due to a cut in funding, that would eventually affect or increase the chances of contracting tuberculosis.
Another problem affecting this part of the world, stigma. Does stigma serve as another challenge for health professionals in controlling some of these figures that we're up against?
Yes, I would say it serves as stigma for health professionals and also for the general population. And back in 2020, early 2020, when we were faced with the impact of COVID-19 in Nigeria and the stigmatization with coughing. So anybody that is coughing, regardless of the underlying cause, people think they tend to assume this is COVID-19. So that alone, affected the tuberculosis detection rates because people were worried about coming to hospitals with their symptoms in as much as they are coughing. Even certain hospitals or clinics or health centers, they were also skeptical about attending to patients who are coughing because of certain policies with isolation and closing down these health centers for like 14 days at those times. So it has been a challenge which was well pronounced during the COVID-19 pandemic.
All right. I mean, the $1 billion fund is a step in the right direction towards the fight against tuberculosis. Thank you for talking to us. Infectious Disease Researcher, Department of Pathology, University of Cambridge, Demola. Thank you for talking to us at this time.
Thank you very much. Pleasure is mine.